This video is about how to give medication into your G-tube, J-tube. My patient here gets some meds in his G-tube and some meds, most of his meds in his J-tube. So I'm going to show you how to connect the tubing to the tube. I have syringes with water. First thing I want to do is make sure, don't bother looking at my mess there. First thing you want to make sure is that the tubing is primed. If the tubing is not primed, then you're going to be sticking air into your patient. So you want to make sure that tubing is primed, putting water through it. Then I'm going to connect my tubing. I'm going to make sure it's closed. I'm going to connect my tubing. This is GT side. So I'm going to line up this line here with this line here. Just push it in and turn it according to the arrow. Now it's locked in, okay? And I have my medication that is going to be going in this side. Because he doesn't get a lot of medicines in the G-tube or any feeding in his G-tube, I'm going to be cautious about how much fluid I put here after I put his medicine in. So here I push his medicine in, and this is my water flush, and I'm just going to flush enough water for the medicine to go through the tube. I don't want to fill his stomach with water because he doesn't get feeding in his stomach, and we don't want to fill his stomach up with fluid, okay? So here we go, we did that, he's done. He had his medication in his G-tube. Now we're going to give his medicine on his JT side. And I'm going to get my tube. This is my new tube. And I'm going to make sure this is closed. I'm putting my syringe with my water here. And I'm going to prime this tube, making sure that there's no air going into his belly when I put the medication in. I got a drop come through the tip of it, so I know it's primed. Close this. I'm going to line it up again. This line has to line up with this line. When you line it up, there's a little notch there. It goes down, and you turn it according to the arrow, and it locks in. Make sure it goes down into the tube itself before you put any medicines in, because you could lose all of your medicine, and that wouldn't be a good thing. When I'm giving these meds, I'm being considerate about the fact that I'm giving the medication with the colors first. And the reason I'm doing that is sometimes the medication sticks to the side of the tubing, and then you have to flush it with a lot of water to get it out. So my medicine with these bright colors, I'm going to give them first. I'm giving them first, and then I can flush it through with my allowed amount of flush that I'm required to give. So here I have 15 ml, and I'm going to flush this tube out. As I'm flushing, I might want to just squeeze the tube a little bit to get the medication off the sides of it, because some of these medications are very viscous and it sticks to the side of the tube. So I just want to manipulate my tube, make sure I get all of his medicines that he needs. Okay, so here we go. He got his medicine in his tube.